So in review of our urinalysis workstation, we were identifying some defects that occurred on a regular basis. We received urines that were leaky, we received urines that were received after a prolonged delay, not in a preservative tube. So a fresh urine has a time constraint in which it must be tested within, and we also had an overall turnaround time that was delayed. And so when we looked at the process steps that were being taken at the urinalysis workbench, we noticed that if a specimen came in a urine collection cup versus a urine collection preservative tube, it actually created a bottleneck in the process. So the collection cup required another step in order to make that sample ready for testing. So when we looked at the overall process, we said, how can we mistake-proof this process so we can reduce the number of leaky urines that we have and also reduce the risk of having a specimen that would be tested after a prolonged delay? So by implementing a preservative tube and a urine collection container kit, we were able to successfully achieve this. So what did that mean? That meant that we had to go back to our suppliers. We had to reach out to the clinics that were sending us urines, our medical center laboratories that were sending us urines, and ask them to purchase a different type of urine collection kit. And this kit included a cup with a vacutainer top, as well as a regular urine collection tube with no preservative and a collection tube that contained a preservative. So if they knew the specimen would be traveling down to our main core laboratory for testing, they would use the urine preservative tube, and so the patient then collected their sample in the urine collection cup, and then it was very easy for the medical assistant or the technologist working at the site to transfer that urine from the cup to the tube via a vacutainer rather than pouring off the specimens, which was leaving us at risk of leaky urines, potential contamination, and also our employees having the risk of having a urine splash. And so we were able to successfully transport these specimens downtown in a specimen container that had a preservative, which reduced the number of delays. It also reduced the leaking urines in transportation. And when they arrived at our core laboratory for testing, they went through our process more smoothly. So we alleviated the step at the workstation that required us to reprint a label and actually physically pour the specimen from the collection cup into the collection tube before we could actually do testing. In reducing that process step, we actually improved the overall turnaround time, both for our routine specimens that were coming to us from our medical centers and off-site laboratories. But as we improved those turnaround times and were able to get those specimens through the process faster, it alleviated the overall bottleneck in the process, which in turn we actually had a better turnaround time for our ER specimens.